Hey everyone, and welcome. Today we're diving into a really important and, let's be honest, a really tough topic. It's one of the biggest fears people have about ADHD. Does the treatment itself actually lead to addiction? You hear a lot of chatter about this, so we're going to cut through all that noise and get straight to what the research really tells us. All right, let's just rip the Band-Aid off and tackle the biggest question right from the get-go. Do stimulant medications for ADHD actually cause addiction? This is a huge, huge concern for so many people, whether it's for themselves or for their kids. And to get a real answer, we have to actually unpack the evidence, piece by piece. But hang on. Before we can even talk about the treatment, we have to understand the foundation here. Why is it that ADHD and substance use disorders, or SUDs for short, so often show up together? Well, the connection is way stronger than you might think, and the reasons for it are buried deep in our own neurobiology. And if you want to know just how strong that link is, get a load of this number. Some major studies show that as many as 43% of adults with ADHD will also deal with an alcohol use disorder at some point in their life. That is a staggering number. It tells you right away this isn't some rare thing. It's a major clinical reality. So what is going on in the brain to cause this? Well, the common ground here is something called the reward system, and it runs on a neurotransmitter you've probably heard of, dopamine. Think of it as the brain's good job network. It's designed to give us a little hit of pleasure for doing things that help us survive, like eating. The problem is, in both ADHD and substance use disorders, this whole dopamine system is kind of thrown out of whack, which creates this shared vulnerability. And that brings us to this really key idea called the self-medication hypothesis. It's pretty much what it sounds like. Someone with untreated ADHD who's struggling with inattention or a mind that just won't shut off might turn to substances to try and cope. Maybe something to help them focus or maybe alcohol to quiet things down. And yeah, it might work for a little while, but it can very quickly become a trap, a really dangerous cycle of dependence. Which of course brings us right back to that huge central question. If the brain's reward system is already in a delicate spot, isn't it super risky to introduce a stimulant medication into the mix? This is the fear we have to address head-on. So let's see what the evidence actually says. Now, to get the clearest possible answer, we're not just looking at one or two studies. No, we're going straight to the top. We're looking at a massive systematic review that was done by VA Health Systems Research. What they did was gather up all the high-quality evidence out there, put it all together, and analyze it to see what the big picture really looks like. And here it is. This is the core finding, and honestly, it might surprise you. After looking at everything, the review concluded that prescribing stimulants to people with ADHD seems to have no effect on their risk of developing a new substance use disorder later on. Let me say that again. The fear that the treatment itself causes addiction, the evidence just doesn't back it up. But like with most things in science, the story isn't quite that simple. While the evidence shows the medication doesn't seem to create new addictions, the review pointed to a different but really important risk, and that is the misuse of a legitimate prescription. So let's break down what that misuse can look like. This data shows that among people who do misuse their ADHD medication, about 31% used it with alcohol, 22% misused it in some other way, 16% actually skipped their meds so they could use other substances, and 10% used it specifically to get high. So you see the nuance here? The risk isn't that the treatment creates a new problem, it's that the medication itself can become part of the existing one if it's not used correctly. Okay, so let's zoom in a little bit now and talk about two of the most commonly used substances out there, alcohol and cannabis. What happens when they interact with a brain that's already wired for ADHD? Let's compare them. With alcohol, it can basically pour gasoline on the fire of impulsivity, which is already a huge challenge with ADHD, and this is linked to a much higher risk for things like binge drinking. Now, with cannabis, it can mess with your executive functions, things like attention and memory, which, sounds a lot like ADHD symptoms, right? It just makes them worse. And what's really concerning is that long-term chronic use can actually drain that dopamine system we talked about, potentially making ADHD symptoms even more severe over time. So with all this complexity, you might be wondering, what on earth does good treatment look like? Well, the good news is that the way we approach these co-occurring disorders has evolved a lot, and it's much more effective and, frankly, much more hopeful today. Today, the gold standard is something called integrated treatment. See, the old way of doing things was to say, okay, let's get the substance use under control first, then we'll deal with the ADHD.
We now know that just doesn't work. Integrated treatment means one team of professionals treats both conditions at the same time because they understand that they're completely tangled up together.
A huge part of this modern approach is recognizing that recovery is a process, not an event. This model, called the stages of change, is a great way to understand that. It's all about meeting people exactly where they are. It doesn't matter if someone doesn't even see a problem yet or if they're actively working to maintain their progress. Good treatment is tailored to whatever stage they're in right now. So what's actually in this integrated toolbox? Well, you've got things like motivational counseling, which is all about helping a person find their own reasons for wanting to change. You have cognitive behavioral therapy, or CBT, which gives people real practical skills for coping. Of course, you have to treat any other underlying psychiatric issues, and very often it involves encouraging people to join support groups, which provide that vital sense of community. And that really brings us to the biggest takeaway from all of this. It's a total shift in perspective. It's about stopping to look at two separate diagnoses, ADHD over here and substance use over there, and instead just seeing one whole person. So I'll leave you with this question. What if the most important step forward, the real key to recovery, isn't just about managing a symptom or a single diagnosis, but about treating the whole person in all of their complexity?